You're shorthanded there?
Missing one person.
Yeah, because they're all new.
No. 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 Brian's not new. Allison's not new. And David. Welcome to Health Talk. Today we will be talking about cross-cultural consideration in healthcare, and we have Dr. Wu here to discuss this with us. Hello, Dr. Wu.
Oh, hello. Thank you for having me.
Can you tell me how this came about?
Well, cross-cultural considerations in medicine came about towards the end of the Clinton administration, when President Bill Clinton, around the year 2000, signed into a law that all federally funded hospitals, doctors should have training in cultural competency. Mm-hmm. And that meant that doctors would be able to understand different attitudes of patients should they come from a different culture, religious background, or ideological beliefs, so that we as physicians could interact with them and really communicate, because the basis of a patient-doctor relationship is communication. And it all began before that with a 1997-98 publication of a book, which is right here on the table, by Anne Fadiman, The Spirit Catches You, You Fall Down. And it was a story about a Hmong child from a family from Laos living in Merced, California, and they did not speak English, and the doctors there did not speak the Hmong language. And then what happened to this child in the ensuing few years when she developed seizure disorder and coma, and the inability to communicate, and the inability for the patient's family to give her the medicines in a timely way as she needed. Now, all patients, regardless of culture, even if they're fully literate in English, sometimes do not take their medicines as the doctors tell you. You know, for example, if you're 80 years old living by yourself, and the doctor says, here are these 5 pills, and some of them are 3 times a day, and sometimes some of them are 4 times a day, the patient may become bewildered and think, well, I'll just take them all at the same time and get them over with. But that doesn't work, because the drugs, the pills, have a half-life. They have to go in either with food, without food. And sometimes it's confusing for anybody, even if they are, you know, Americans and are part of this culture. So that's sort of also health literacy, and that's in a way cultural competency also, because we have to understand the culture of the elderly, because sometimes they're living all alone and don't have the help that they need. And as we all have more birthdays, and many people are now in their 90s or their 100th birthday, because American healthcare has been so good, that these people lose a little bit of cognitive function, so they're not able to remember, and they may not be able to remember which pill is, you know, breakfast, lunch, dinner, bedtime, and which one's only breakfast, lunch, dinner. And it's hard for patients to understand, what does 4 times a day mean? Does that mean I can take it at noon, 2 o'clock, 4 o'clock, and 6 o'clock and get it over with? Or does it mean, you know, breakfast, lunch, dinner, bedtime? And other issues about cultural competency and cross-cultural issues in healthcare is that it's one thing when a patient comes in and they bring a family member, and that family member acts as the cultural broker and the interpreter, because then you save yourself trying to find an interpreter. But it's another thing when the patient comes in through the ER, they're desperately sick, and there is no interpreter at 2 o'clock in the morning, or a cultural person, a cultural broker, or somebody who says, well, my grandmother is ill and she's Buddhist and she will not go for a blood transfusion or a corneal transplant or a heart transplant or an organ transplant because that's against our culture. So as an emergency room physician, one must understand that some cultural beliefs will prevent them from accepting a certain type of medical care that's deemed normal, you know, part of what we think is good for that patient.
Let's go back to the law and how it got implemented, and how it came about.
Well, the law came about, Bill Clinton actually had a town